Okay, I can see it's recording. Right, well, hello, my name is Nessa Barry. I work at NHS 24 and I'm with Diane Pennington, Dr. Diane Pennington, and I'm delighted that Diane has joined us today. Diane Pennington works at the University of Strathclyde as a lecturer in information science and course director. And Diane is going to speak to us today about some work that she's been involved in and also has contributed to a brand new book, which is hot off the press, which you'll see a little bit more information about when Diane starts her presentation. And just to let you know, these webinars are being recorded as part of Scottish Digital Health and Care Week 2018. And the plan for the webinars is that we record really interesting topics that we just couldn't fit into the program for the conference or other events that were happening during the week. So the webinars will be recorded and will be made available to you as soon as possible to listen to. If there are specific questions, obviously you can follow up with the presenter, or you can follow up with myself by going through the Centre for Telehealth and Telecare NHS 24 website. And if you want to ask a question, you can raise your hand if you can see the screen, and if you're familiar with the technology, you can raise a hand to ask a question. But I would advise, really, if you want to ask a question, you use the little chat function that you will see at the bottom of your screen, a little speech bubble. You click on that, you type in your question, and that way we can see your question as the presentation goes on, and we can pick it up when Diane has finished speaking. That's probably the best way to do it. So if you think of something about 10 minutes in, type your question in and we'll pick those up when Diane has finished her presentation. Otherwise, I would ask you to please keep yourself on mute, as I will do in just a moment, and that helps us to reduce the background noise and the likelihood of any interruptions. And I will just hand over to Diane, if that's okay.
Okay, Nessa, thanks very much. Just to make sure you can see my slides okay on the screen.
Yeah, perfect.
Okay, great. Thank you for the invitation to do this. I'm really happy to be part of Digital Health and Care Week. This is a really exciting thing to do. So I'm happy to be presenting, as she said, a book that was just published literally last week, I believe. So this is the cover and the back cover for the book. It's called Social Tagging in a Linked Data Environment, which I co-edited with my colleague, Louise Pateri. And basically, we were looking at, from an information science perspective, which is where we come from, how tags that we use on the internet to describe things, the hashtags and so on, could maybe help us find things in different ways by linking resources together that would not otherwise be found or linked together. So if you want to learn more, you can read the book. But in this webinar today, I'm going to particularly focus on one chapter that I contributed to the book, which relates specifically to dementia and some things that we can think about with dementia on the internet, since this is Digital Health and Care Week, after all. So I'm sure that everyone knows what dementia is who's here, but just as sort of a brief definition and some things that I really want to focus on is that dementia itself, even though it's comprised of a range of different kinds of diseases, of things going on with the brain, and there's no particular cure, we need to remember that dementia itself is not a normal part of aging itself. But sorry, can everyone mute, please? I'm hearing a bit of noise. But the problem is that our view of dementia as something that is like, as soon as we find out about it, it's a death sentence. The problem is that in the medical profession, sometimes what happens is that people don't worry as much about the quality of life of the person with dementia and sort of the future that, well, they're just going to die, so it doesn't really matter. But what I really believe in is a human rights-based approach to dementia, which is basically saying, well, you know, they are still people. Obviously, they get the same rights as anyone else does, as any human. And we also, I don't believe, can make the assumption that because their brain has changed, that they don't know what's going on anymore. So they have just as much of a right to care and research and treatment and everything else, just as much as everyone else does. And so I'm working from that. This was, I've included some bits of poetry that people with dementia have written throughout this presentation, and this one I thought was quite great. This was from Irene, who said, this was a great story. We ought to write a story like this. You could go on and on for years. We'll make up a story, the whole set. You're going to have a great story. What a pity I didn't write it up all over. What is the hard part if you don't remember them? What is the pity of it if you don't remember them? It's a strange world, isn't it? You can see a lot going on in this poem and what she said here, but, you know, maybe things aren't explained the same way that she might have explained them earlier in her life. Maybe things aren't clear in the same ways, but that doesn't mean that she's still not thinking about life and considering the story of her life and where her life is at this point in time. So we have to keep that in mind. This was my father, who passed away of frontal lobe dementia in 2010. On the left there, obviously, that's a picture of me with him many years ago. We were both much younger at the time. And then on the right was a picture of him after he had received his dementia diagnosis. But that was on his birthday that day. You can see him, he's kind of holding the cake. You can see it a bit at the bottom, and you can see he's just as happy as he was back when we took that picture years and years ago. So as a person, he didn't really fundamentally change, although some of his abilities, of course, changed. But he was still my father, Dave, and that never changed. Particularly in my field of information science, there's been a call recently for more research into dementia care, not only because it's access to information is something that we believe in ethically and morally, as something that everyone has access to, any kind of information that might be needed, so that we're not denying people knowledge to anything. The World Health Organization has specifically said that people with dementia have the right to have dignity, respect, care, support, equality, just the way everyone else does. And for me, as an information scientist, part of this is information, because we need information in every situation in life, but especially when we're faced with a difficult diagnosis, so that we can make decisions about our care. And of course, if you know anything about how dementia changes over time, the information that we need will be different at the beginning, where we're just wanting to know what might happen, all the way to the end when we're at, you know, at the sort of the hospice and palliative care stages. But we all have different needs, whether we're members of the family with the person with dementia, the doctors, the practitioners, the clinicians, and the person with dementia themselves. And it has been noted that professional information, such as clinical information, isn't valued necessarily the same way by people with dementia, because it's not focused on them as a person. It's really focused on just the medical diagnosis and symptoms. So this is something that we need to consider. When we think about information in a sort of a larger point of view, I view this as a system of people, the person with dementia in the center, and all of the things surrounding them as a system. And I'll show that in just a minute. That's part of my book chapter. But the idea of information can mean anything, according to some of the theorists in the field. So it doesn't have to be necessarily just a book or a website or something. It can be anything we can absorb in the world. And all of these things don't necessarily go away. We don't know if they do go away or not when people have dementia. We do know, however, that language becomes different. Meanings might change to them. Meanings they ascribe to certain words was certainly the case with my father and his type of dementia, and that things kind of get more complex. So we have to take this into account. So this is the system that I was referring to. We call this an ontology in information science, which is just defining the structures between having the person, in this case, having the person living with dementia at the center, and having all of these things that surround them that can impact on their lives and that they impact on. So what the media tells us about people with dementia, family, friends, dogs, government, charities, professional carers, reminiscence as potential therapy, all the stigma that's associated with all of this, but the stories of their lives as well, and how they can continue to contribute to society through the condition. So when we think about all these things surrounding them, what is really needed is different kinds of information sources to support these different things that they interact with in the world as they go through the condition. This was a picture from a study of people with dementia from a few years ago, and what they did was they gave them cameras and had them take photographs of their lives. And this guy had a fairly recent diagnosis of dementia, but he was working. He got a job in a shop, obviously, and he was taking pictures of himself at work. And as you can see at the bottom, the caption or what he said about it, "I don't know what I do each week, but I know I'm enjoying it and having a good time." And I think that's a really important thing for anyone, isn't it? And so as in the case of my father, he had aphasia. He had different words that he used for different things, but they still will try to communicate. But sometimes other methods of communication are better such as music. They have, just incredible capacity for music. That never seems to change. Things that their bodies might tell them about how they're feeling or what has changed in their bodies is also something that we need to be aware of, we need to be able to understand, which becomes more difficult as their cognition changes. So what kinds of types of information can best reflect all these different sorts of needs and information that they're receiving and what they would like to send out to the world? And how can we support them at work for as long as they can remain active? So the different things that we might do, Googling something is one of those common things anyone does online these days. So if you were to Google the term Alzheimer, for example, this is what I got in a search this morning. Just, you get things about the Alzheimer's Society, you get alzheimers.org, Alzheimer's disease, NHS is down there at the bottom, and you get all these things on the right-hand side that are related to social media and other sites, which I will come back to in just a minute later on here. Twitter is fairly active in talking about dementia in different ways. They use different hashtags that they talk about with dementia, Alzheimer's, dementia care, World Alzheimer's Day. And if you look at the one at the bottom there, one is hashtag I love you mom, which obviously is not specifically a dementia hashtag, but we have to consider what are they trying to say with this hashtag. So she's still talking about the mom that she loved who got taken by dementia. And so these all have meaning in different ways. They're not all completely literal. They may not all make sense to everyone, but they do have meaning for the people that provide the tags, which is why we need to consider them. Some of the work that I've been doing into looking at how we can work better with people with dementia to understand what they need, to explain information they need and communicate information is basically that sometimes the text of a big page of things to read, a big article, a big book, even a leaflet, sometimes can be too much because, again, their cognition changes, and so it becomes more difficult to kind of follow it. They've found in some cases that sometimes a video or a DVD or pictures, things that are not textual, can be more digestible, basically, in terms of understanding the information. But that's true with a lot of people, whether or not they have dementia, that sometimes people would rather watch a video than read something. And of course, that's personal preference at times, but forms of information and how they're presented are important for everyone. Using non-textual methods, as we call them, for health improvement and communication improvement has been explored to some degree especially for dementia care. These screenshots are from an earlier prototype from 2009, which I think, even though it's a few years old now, I still keep coming back to this idea because they had put this onto a touch screens-based system, and it allowed people with dementia, in this case they were in a care home, to make music with the system. And they could decide if they wanted to have happy music, sad music, angry music, but with the happy faces at the bottom, and they could move their fingers around on the screen to make music. And it was programmed luckily so that no matter what they did, it sounded good. And they observed them working with this prototype system in a care home setting, and they had a wonderful time with it, just making music and having fun with one another. And we really, things like this, I think, need a lot more work to make these things much more accessible. So here we have some more words from another person with dementia. This is from May, and she just wants to be herself. She says, I just want to be at home. I have a right to this part of the end of my life. Yes, I'm wringing my hands. I can't cope. I have a right to a life of my own. I am really very angry. I just want to be at home and be myself. Do you have any ideas? So she's looking for help. She's looking for information here, but she doesn't really know what to do and doesn't really know how to make her life better, but she just wants to continue her life as much as she always has in the same way possible. So this was something I have in the book chapter. If you were to take parts of those words and match them up to images, so that if the images might have more meaning to people or more easily understandable meaning than the words, to match them up with things that might have similar representations. So you see somebody who looks angry, you see somebody wringing their hands, you see somebody at home being happy, somebody who wanting to enjoy their life, somebody looking for ideas. So if we were to take that narrative of hers and put that into pictures to sort of break it down into different sort of tags or representations of things that we could maybe link to various kinds of resources. This is the idea that I'm sort of exploring in this book chapter, to see if we can get people that are linked up to different kinds of information. So what I'm calling here is linked data is kind of the term that we've used throughout the book. And linked data is a very new sort of internet technology. It's also called semantic web. It's also called Web 3.0. And the idea behind it is that the code allows computers to be able to match things up semantically by meaning rather than just by simple words, so that if you type in something like Alzheimer, it will be able to link to things related to dementia, things related to brain diseases, things related to other things, and to allow the computer, even though computers can't understand meaning, to be able to understand what the relationships are between these different terms from different places around the web, and hopefully to bring people to a variety of different kinds of resources. So this is part of that Google search that I did earlier for Alzheimer. If you do a Google search, you'll see with popular topics, that terms that have a lot of things related to them, that on the right-hand side, you'll see this. This is called a knowledge graph in Google. And what this shows is places where around the internet that might be related to your search term. So it brings all these sources together for you, so you don't have to go to them individually. Obviously, at the top, it highlights the Alzheimer's Society, which makes sense. But you also see social media profiles, Facebook, Twitter, Instagram, YouTube, other kinds of charities down there. You see Age UK, you see the Alzheimer's Society of Canada, Alzheimer's Association, and so on. So what Google's doing here is using this linked data technology to go out, take your search term of Alzheimer, and get all of these different sources together in one place for you, so you don't have to go to each one of them individually. So the premise behind what we're exploring in the book, generally speaking, is it possible to link data using social tags like hashtags or the kinds of terms that people would be using? They don't even necessarily have to be textual tags. You know, if you think about taking May's narrative and putting it into pictures, can we use pictures to help link people to different kinds of resources in different places and in different ways? And currently, I wouldn't say that this is all technologically possible, but the book explores the idea both conceptually and looks at some options for the future about how this might work from a technical perspective. So there's lots more details in the book, obviously, but that's just the basic idea. So sort of concluding the idea here in the chapter, determining how to offer services and information for people with dementia and anyone surrounding them. So people in the system, we have to figure out how to make this information and services understandable, relatable, comprehensive, but appropriately comprehensive, because sometimes too much information is also not a good thing. So how much do we need? What format does it need to be in? And the way that I'm suggesting here is that can we do this by linking this communication to and from resources around the web that provide not just biomedical information where we see formal definitions of dementia and lists about what care options they have and what's the prognosis and how long will it take and all these, but also supportive social media sites and forums where people can support each other, videos that might contain more digestible information, photographs, music, even if it's not informative music, just things to make their lives a little more enjoyable, products that might help their home lives be more manageable, and all kinds of things that what we need to find is a way to do this. And I'm suggesting social tagging as one possibility, whatever that looks like. Even it might be different 10 years from now even, but what does that look like if we were to take their terms and their ways of describing things, whatever that is, and to help that, use that as a source to link to places around the web that might be of use to them. So we're actually working with their terms rather than what we tell them they need to be using or what is assigned to them by a system. So if we look at, for example, Alzheimer's Scotland website, I just did a quick word cloud there of what all of the words in their site according to this word cloud tool. So you see a lot of dementia several times, Scotland, support Alzheimer, but you see further, some of the smaller words where you see personalized, you see action, you see different cities in Scotland, and we look at some of the smaller terms, you start to see that kind of the wide range of things that are needed and desired by people. And then, of course, I just threw the dementia dog in, not because he has anything to do with social tagging or linked data, but just because I think dementia dogs are amazing. So just that's kind of what I wanted to share. I guess at this point I can take any questions or comments that anyone has, if anyone is still out there with me.
Thanks very much, Diane. It's Nessa here. Just before I ask if anyone wants to ask a question, I'm just going to check on the chat function as well. No, that's okay. I had a lot of thoughts about it, and I won't hog the time, but I thought there was an interesting connection. In the last 5 years or so, we hear a lot in healthcare, specifically in medicine, about personalized medicine and about the ability to use technology, use data, use a whole range of things to make more targeted prescriptions, diagnosis and treatment for people. So I could see almost like a parallel in my mind with the way we use information and more personalized information. And I think you made a really interesting point at the beginning, because every one of us has some family or extended family experience with dementia or another long-term condition or a life-changing condition.
Right.
Where you get information, but you either get so much it terrifies you, or you get information that's really not relevant to the stage you're at. And it's usually in a paper format, quite often badly photocopied. Because I was thinking, well, maybe there's a negative here. What if you're not the person who searches online? What if you don't have access to those technologies? Obviously, that's going to increasingly change over time. Right. But really, the alternative of paper-based information resources is not great.
No.
Let's be honest.
No.
So I found it fascinating, but I'm going to stop now. Grant, did you have anything you wanted to chip in? Grant Gibson is with us now. Oh, Grant, you're still on mute, sorry.
Yes, I've just unmuted now. Yeah, I suppose to expand from that, the question, I'd agree with most of Nessa's points. I suppose the question I have is actually, how do we integrate the sort of the information sources that are out there at the moment within sort of professional practice, whether that's health professionals, GPs, allied health professionals, or whether it's in social care. Because we know there's a lot of information out there, but sometimes even the social care professionals don't know about the information that's there, or don't really know how to use the information that's out there.
Right. Nessa, do you have any thoughts about that? Because I know you work with a lot of professionals directly.
Yeah, one of the things when we're talking to big groups of health professionals and allied health professionals and social care staff, increasingly we talk to them about how they find information, exactly that sort of question, Grant. Do they use the paper resources that are available, or how do they use the knowledge that they have with the local community and the resources available? And we do see more and more people using resources like, for example, the ALICE, the website, which has recently been refreshed. It's more than a website, that's not really fair, which has a really extensive list of more localized resources and information that's also kind of credible and checked. That's quite important. And I'm still not sure how we get beyond that to something that would be comprehensive enough to take in all the possible resources that are out there, even in your one local area. I live in West Lothian. Just recently, somebody was talking to me about a dementia cafe. I had no idea we had a dementia cafe in this town. Now I know, but how would I have found that out? So that's the question. How do you find it out? And if you look on Alice, you'll see a lot. You still won't see all of it. That's not really a good answer at all, Grant. I'm not sure is the honest answer, because I was thinking also when you were speaking about images and music. We featured Playlist for Life a few years ago in the conference in Digital Health and Care Week, and Sally Magnuson came and spoke briefly about it. And that's a fantastic resource. Music generally is very helpful for a lot of people with dementia, living with dementia. But it's quite hard to get that woven into the day-to-day care. And I think if you're a carer, it really depends on the burden of care and where you are at in that journey. The stuff about images and connecting up images in a way of being able to tag, so it wasn't just words but images, I thought that was fascinating. I don't really know anything about that, but that's fascinating. Years ago, I worked with young people, kids with learning disability. We used quite a basic but really helpful image-based communication system for people who were nonverbal. And it was really basic, a board with images on it that would light up with a word. But it worked, and it made it possible for us to interact. So I find that fascinating, that could we tag more than text, and how do we do it? And I wondered whether companies have actually, are they looking into this? Is this something not just Google, but other companies active in health and care? Are they looking into this as something that might be of interest to commercialize it?
I haven't seen any examples of it currently. I would like to see it. I think that we're still really stuck quite a bit on text for description, even though so much of the material that is new on the internet is not textual, which is really interesting to me. I started my PhD was on image retrieval research. So I've been fascinated with this for years, but I still feel like there's a gap between what you see in an image and what the text itself can actually describe about it, that you kind of lose something when you're kind of translating between text and image, and that can become even more difficult if your cognition changes, I think. So I think it's really something that we need to look at for some further development options.
Yeah, I mean, there's been some interesting work done around dementia in terms of using the arts and creative approaches, and part of that has been around looking at sort of alternate means than the written word to communicate. For example, issues around consent in research. So I have seen over the past few years a number of projects that have done things like create comic books. So instead of a written information sheet, the information sheet for a research study is turned into something that's closer to a comic. And they can be very effective. One of the problems you can have, however, with things like that is overcoming the sort of how can I put this, the bureaucratic requirements of things like ethics committees. Particularly if you're doing any research with the NHS, where you have to have a very, your information sheets always have to look in a very specific format. And if they don't take that format, it can be very difficult to get that approval.
That's true.
But certainly there's scope for using those kind of methods. But I think almost the sort of the bureaucracies around the services that might be engaging with them needs to kind of update its practices as well, I think, in some cases. I don't know whether that's true across the board, but...
I think that's a very fair point. I should give a shout out as well to my NHS 24 colleagues who are working on the National Services Directory with Macmillan, and they've been spending, must be 18 months now, going all over Scotland, talking to voluntary groups, community groups, church halls, school halls, shopping centres, everywhere, top to toe for the country, and trying to help people share the information they have about local resources, like not to replicate what Alice does, but to make it more specific to health and community initiatives and things like that. So that's another development. And I suppose, trying to think about your question, Grant, of how do we shift it, or how do we move it forwards? It has to be a bit of both, doesn't it? The kind of top-down companies or organizations that have a bit of money and a bit of time, and obviously the expertise for people like yourselves, but also others to actually push it, but also the bottom-up stuff. If we really believe that Scottish approach to service design is a co-produced, co-created one, then we kind of have to put our money where our mouth is on that one, and work with people, and I think there are lots of great examples of that happening, don't get me wrong, but and the final thing I would say really is the stuff about the visual and using arts or using other techniques. Just this morning I saw a short, maybe a 4-minute video that Alzheimer's Scotland have circulated about delirium, and it uses a mixture of drawing and it's narrated and really simple and spoken from the voice of a carer, of a citizen and a service user. and just really quite effective. And I thought, that's really good. And I thought, well, I share that, but you almost assume people will know about it. I think that's another thing we run into. If you're vaguely active in this field, you kind of assume the wider population know about stuff that might actually be really useful to them, and maybe they don't. And maybe better tagging would help people find resources like that speak to them in a very direct way and explain things, without having to, read a whole PDF document on the subject.
Exactly. Right.
Yeah, I thought I'd just add there, actually. I think in Scotland, compared to other countries, for example, England, with the requirements or the guidelines in the first, second, third dementia strategies around post-diagnostic support, actually gives, in theory at least, gives a strong platform for that sort of information provision to take place. And particularly at a local level, about, well, what local resources might there be to support a person with dementia and a carer, whether that's a dementia cafe in Stirling or a dementia-friendly project in Dunblane, for example. I think what we need to probably think about, though, is within the context of that post-diagnostic support that's laid down in the strategies, about what's needed at that local level amongst those amongst the linked workers or whoever it is that's providing the support. What resources do they actually need to be able to kind of fulfill their role at that local level? I think there's an interesting question that can be asked there about, what resources do they need to actually do that job.
Yeah, I'd agree. And recently I've spent a bit of time with a different a project called Empower, and the teams, some of the teams involved in that, and they're a mixture of community navigators and link workers, as we tend to refer to them. And they're based in different sites in Scotland, but also Northern Ireland and in the Republic. And it's all about developing health and well-being plans with people a bit more preventively in the community. The community navigator taking the lead, going into community groups and families and going directly, obviously, to people's homes. And included in that kind of health and well-being plan would be some digital options, but really it's much more about what you need, what's available in your local community, and how do we help you get it. And when I was speaking to them, they said there was this slight risk that they raise expectations for things they can't deliver, and on the other hand, that they don't know all of what's out there yet. And it is exactly that problem you have when you're trying to help. You want to help, but are you even aware of all the stuff that's out there? So maybe the voluntary sector staff, as well as individual families and carers, the voluntary sector staff and the health staff and the care staff, who also need to understand how to find things that would be useful. That we're just assuming, maybe I'm assuming too much, that it would be the family or the carer. Actually, it's all the staff surrounding them, isn't it?
Yeah, it certainly can be. I do wonder how useful some sort of mapping exercise of the different models across Scotland that determine how this post-diagnostic support's actually offered is would be a useful exercise to take place, I think, just so you can actually map out what's happening within different local communities and how they're delivering information, resources to people differently.
Is that a research project that you and Diane are going to go?
It could be, yeah. It'd be a good idea for one, certainly. We'll put it down.
What is the best model for community navigator support and information finding? There you go.
Thank you.
It's been really interesting. And I also like the fact that you flagged up the anger from the experience of the user, of the person living with dementia, and the frustration and potential anger.
Yes.
And again, that made me think of that delirium video that I was watching this morning. We often don't understand what's happening with somebody. So not just obviously with dementia, but we either medicate for it, or we try to control it because we just don't understand what's going on, really.
No.
If people could find a better way to help them communicate with us, maybe we could alleviate some of that.
Exactly.
Well, I'm going to say thank you very much, Diane. Grant, is there anything else you wanted to chip in, or are you?
No, not at the moment. Myself and Diane are in contact about various things. We've been working together on various things over the last couple of years, quite a lot. So yeah, a lot of the topics that have come out of this, I'm certainly more than familiar with.
Okay. Well, Diane, I hope you found it interesting. I certainly have.
Oh yeah, definitely. Thanks for your thoughts, both of you. I really appreciate the input. It's great.
We did have another person who was with us for most of the webinar before we got to the discussion, but they've dropped out. So yeah, if you can, once you're familiar with Zoom, but once you close the webinar, it'll render to an MP4 file. And if you can share it with me when you're ready, or we can figure out where you want to host it, that would be great. And then I'll share it with everybody I can possibly think of.
I will do that. Okay. Thank you very much.
Thanks.
Thank you.
Thank you.
Bye-bye.
Bye.